So you've lost weight, you feel lighter, your clothes look better on you, and you feel more healthy. But there's one issue that kind of skipped your mind when you were losing weight: the skin that's left after you lost weight, the laxity, the loss of elasticity, the loss of tightness. I'm SIROON Minas, I'm a plastic surgeon, and today we'll talk about all the non-surgical procedures that you can do that will help you have a tighter skin and feel more confident. And when is the best time to just skip it all and go for surgery? So today, that's what we'll be talking about: what to do after you lost weight. Why does your skin become loose after you lose weight? So imagine your skin is an elastic tissue structure that has adapted to the volume of your body and your face for many years, and suddenly you have your weight loss and the skin has to adapt to the new volume. So this adapting process depends on your age, your genetics, it depends on your collagen and elastin, the quality of your collagen and elastin in your skin. Also depends on your lifestyle. If you smoke, if you eat healthy, if you exercise, also it depends on how sun damaged your skin is. So all these factors will determine if your skin will be able to adapt or not. So if you're relatively young and your skin is still more elastic, these changes won't be very prominent. And also it depends how much weight did you lose, how long did it take you to lose. So if you've lost a lot of weight relatively fast and your collagen, elastin are not in a good place in your life, you'll have loose skin. Now, what to do with the loose skin? One, and also before we get into that, I would like to say, especially concerning your face, some of the changes you see on your face after losing weight are not because of loose skin. It can be also because of loss of volume. Your ligaments can get more droopy. So you have to address the face as a whole. Is it only loose skin, or do we also have to address tissues that are deeper and also maybe have volume replacement and bring them back to the place they were originally created to be? Now, what procedures can actually tighten your skin? So today we'll be talking about a few of them, like RF microneedling. We'll talk about lasers. We'll talk about HIFU, mass lifting, and also we'll talk about a new technology, subdermal RF. That all these procedures help with skin tightening. Also, we'll talk about when just to skip all this and go for the surgery. RF, radio frequency. How does it work? Radio frequency works by using electrical energy to generate heat in the tissues, and this helps with collagen remodeling and new collagen synthesis. So we have new collagen formation. So some patients might see some tightening immediately after the procedure, but usually collagen stimulation and the formation, all this doesn't get done overnight. So it takes a few weeks to at least a few months. So if you want to see the final result, we usually wait 2 to 3 months at least. So immediately you might see some changes, yes. They might be due to some slight tightening and some slight swelling, but the results we see 2 to 3 months after the treatment. Then the next one will be RF microneedling. RF microneedling uses the same RF energy, it's just that here we have like micro needles that we use to penetrate the skin, and we are able to manage the depth and control the depth that we penetrate the skin, and the RF energy will be in that depth that the doctor has already used or put in on the machine. So here we can also go in deeper layers of the skin and have a better effect. Also because of the microneedling, we also have effect on the surface, the texture of the skin, like post-acne scars, like pores. We can minimize pores with this procedure. We'll have a smoother, better texture. Even some pigmentation might get better and might get lighter, and plus also the skin tightening, which initially we already knew that RF does. So then the next procedure will be HIFU or mass lifting, which I'm sure you've heard about. This uses ultrasound energy and focus ultrasound energy, which can go deep into the deep tissue without penetrating the skin. So this is ideal for moderate to mild to moderate skin laxity and sagging and drooping, the jawline if you have droopy jawline, also if you have a double chin, especially if you have volume displacement. This procedure also helps with that. So it has almost no downtime. You might have a slight pinkish and redness after the procedure, but that goes like in 10-15 minutes, so no downtime for this procedure. Whilst with the RF microneedling, you'll have a downtime, so you can have redness and like soreness for about 24 to 48 hours, which is normal, as part of the procedure. Okay. Then the next one will be lasers. We usually use lasers for the skin tightening, especially if we have to deal with the surface. Also, if we have like a wrinkly, more creepy texture of the skin, we have sun damaged skin also. So in this, also pores, and also in this case we prefer the lasers, but we have to keep in mind that lasers will have effect on the surface of the skin. So deeper tissue, if you have the sagging of the face and all the other volume disposition, a laser alone won't be enough, so it has to be combined with another procedure also to have a better result. So the main lasers that are used are the fractional CO₂ laser, Arabian YAG lasers, and also keep in mind that lasers, you have to be more cautious if you are have a darker tone, so to not have post-inflammatory hyperpigmentation. So choose your doctor wisely, so that the doctor can choose your laser and the laser parameters wisely. So then the last but not least will be the subdermal RF. So now you don't only use the RF from, let's say, externally on top of the skin. We use it cannulas and electrodes to put the RF deep into the skin, into the tissue of the face, which helps and gives multi-dimensional lifting of the tissues, ligaments, also in the skin and all. So this is more of invasive procedure, so here we need anatomy and proper knowledge. So it's not a facelift, but it's ideal for people who haven't yet decided to get a facelift, but they want the lift, they want the youthful glow, they want the tightened effect on their face, maybe until they decide they want to get the facelift later. Okay, so we talked about a few procedures, but it's not that one of these procedures is the ideal. Usually for each individual patient, we usually combine them. We like create this perfect individualized, custom-made treatment plan for each patient, depending on the skin, age, what are the results that we wish to see, the anatomy, and the changes that we have at the moment, and what we need to address. So it's not one procedure goes for all, it's individualized depending on the results and the patient that we're working with. So see you next video. I hope it will be next week. So, but let's please, I want to read see in the comments how much weight have you lost, how long did it take you to lose the weight, and which is the zone or the area on your face or body that bothers you the most and you wish you could correct it. See you next week. Lots of love. Remain blessed.